Welcome to the Health Talks podcast. Today, we're joined by our co-hosts, Mr. David Jones and Ms. Jessica Brown. Our today's podcast topic is Understanding Viagra, Uses, Benefits, and Potential Risks.
Hey everyone, and welcome back. Looks like you guys sent us a ton of info on Viagra, so I guess that means we're taking a deep dive into the world of this little blue pill, huh?
It really is remarkable how one medication can spark so much curiosity and conversation. We'll be exploring everything from the science behind how it works to the impact it's had on society as a whole.
There's a lot more to uncover than just the headlines, right? Like, how does Viagra actually work on a chemical level?
Well, Viagra, or Sildenafil as it's known generically, is what's called a PDE5 inhibitor. And to really grasp that, we need to understand what happens in the body when a man is sexually aroused.
Okay, so break it down for us.
So when a man is aroused, his body releases nitric oxide.
Nitric oxide, got it.
And that triggers a whole chain reaction that ultimately leads to an erection.
Okay, so nitric oxide is like the starting signal for the whole process.
You got it. Nitric oxide activates an enzyme called guanylate cyclase, which then produces a molecule called cyclic GMP. Now, this cyclic GMP is what relaxes the muscles in the blood vessels of the penis. This allows blood to flow in, leading to an erection.
So where does PDE5 come into play?
PDE5 is the enzyme that breaks down the cyclic GMP. Essentially, it's like turning off the erection process.
Gotcha, so Viagra basically blocks PDE5 from doing its job.
Exactly. By inhibiting PDE5, Viagra allows cyclic GMP to stick around longer, which enhances the body's natural response to sexual stimulation.
So it's not creating something totally new. It's more like giving a boost to what's already there.
That's a great way to think about it. And it's super important to remember that sexual stimulation is still absolutely necessary.
So Viagra isn't like an instant-on switch.
Not at all. It just helps optimize the body's natural mechanisms.
Now, something I found really interesting when I was going through all this research was that Sildenafil, the generic form of Viagra, is also used to treat something called PAH.
Pulmonary arterial hypertension.
Right, PAH. I was surprised to see the same drug used for these two seemingly completely different conditions.
You know, it really goes to show how powerful it can be when we understand the underlying mechanisms of a disease.
So tell me a bit more about how it works for PAH.
In PAH, the blood vessels in the lungs become constricted. This makes it much harder for blood to flow through and pick up oxygen. Sildenafil, which is actually marketed as Revatio in this case, helps relax those blood vessels. This improves blood flow and takes some of the strain off the heart.
So whether it's the lungs or, well, elsewhere, it seems like it all comes down to optimizing blood flow.
Precisely. And of course, dosage is absolutely crucial here.
Right, because you don't want to be popping Viagra when you're trying to treat PAH.
Exactly. The dosage for Revatio is significantly lower than what's typically prescribed for Viagra.
So this is a great reminder to always consult with a doctor. They can figure out the right dosage and the right formulation based on your individual needs.
Couldn't agree more. Self-medicating is never a good idea.
Now, speaking of medical guidance, are there certain folks who maybe should be extra cautious about using Viagra?
Definitely. Men with certain heart conditions, especially those taking nitrates for chest pain, need to be extra careful. Viagra can interact with nitrates, and that can lead to a dangerous drop in blood pressure. Also, anyone taking certain blood pressure medications or dealing with liver or kidney problems should definitely consult their doctor.
So open and honest communication with your healthcare provider is really key here.
Absolutely. It's about understanding your own individual health profile and making informed decisions.
Now, let's talk about the benefits of treating ED that go beyond just the physical. We've talked about the mechanics, but what about the psychological and emotional impact?
That's a huge part of it, and it often gets overlooked. Imagine the sense of relief and the boost in confidence someone might feel after overcoming a challenge like ED. It's a very personal issue and often shrouded in shame.
It's like a weight being lifted, both physically and emotionally.
Exactly. Addressing ED successfully can lead to a more fulfilling sex life. And of course, it can improve intimacy with a partner. And it can even have a ripple effect, bringing more positivity to other areas of life.
So it's about restoring a sense of control and well-being.
That's a great way to put it.
It seems like Viagra's impact goes way beyond the bedroom.
It really does. It's about improving overall quality of life and relationships.
Now, we also have to acknowledge the role Viagra has played in destigmatizing conversations about men's sexual health.
That's a really important point. Before Viagra came along, ED was often a taboo subject. It left a lot of men feeling isolated and ashamed.
It was a conversation that just wasn't happening. Or if it was happening in hushed tones.
Exactly. But Viagra, with all the media coverage and open discussion, helped bring the issue into the light. It encouraged men to seek help and prioritize their sexual well-being.
It normalized a conversation that needed to be had.
I couldn't agree more.
It's incredible how a medication can spark such a big cultural shift.
It really is. It speaks to how interconnected our physical, emotional, and social selves truly are. Now, while Viagra has been revolutionary, we can't forget that it's not without its potential side effects.
That's a good point. Every medication has its potential risks and benefits, and it's crucial to be aware of those.
Of course. So in terms of common side effects, things like headaches, flushing, indigestion, nasal congestion, and back pain can occur.
So more like inconveniences than anything super serious.
Right. But there are a few rare but serious side effects that do require immediate medical attention. Those include priapism, which is a prolonged and painful erection lasting more than 4 hours. Also, sudden vision or hearing loss, and in rare cases, heart-related complications.
Okay, those sound pretty serious. So it seems like open communication with a doctor is really essential throughout the entire process, from discussing potential risks and benefits to addressing any concerns that might pop up.
You've hit the nail on the head. It's about working as a team, you and your healthcare provider. That's how you ensure safety and well-being.
Well, I think that's a good place to pause for now. We've covered a lot of ground in this first part of our Viagra deep dive. We've explored the science, talked about the potential benefits, and really highlighted the importance of medical guidance. But there's so much more to uncover.
Absolutely. In the next part, we're going to dig deeper into the social and psychological impact of Viagra. And we'll explore some of the fascinating ways it's reshaped conversations about men's health and sexuality.
So make sure you join us for part 2, where we'll continue this journey into the world of this little blue pill and its far-reaching effects.
Welcome back to our deep dive into all things Viagra.
So last time we really dug into the science behind Viagra, and we started to touch on how it affects individuals and relationships.
And now we're going to take a step back and look at the bigger picture. How has this medication changed society? How has it changed relationships in some really profound ways?
That's what I find so fascinating about Viagra. It's not just a pill, it's like this cultural phenomenon.
You're absolutely right. Viagra's debut back in the late 90s wasn't just a medical breakthrough. It really shook things up culturally. Suddenly, this topic that had been taboo for so long was thrust into the public eye.
Yeah, I remember seeing those commercials everywhere. It felt like you couldn't escape Viagra.
And that widespread media coverage, while it was sometimes a little over the top, actually played a really important role. It helped destigmatize erectile dysfunction. It brought the conversation out in the open so men could feel more comfortable seeking help.
It challenged this idea that ED was something to be ashamed of, like you just had to suffer in silence.
Exactly. And that shift in perception had a ripple effect. It encouraged men to start prioritizing their sexual health and well-being. And that, in turn, had a positive impact on their relationships.
So Viagra sort of opened the door for more open and honest communication between partners.
Absolutely. It gave couples a way to start talking about intimacy, about desire, about the challenges that can come up in any relationship.
Now, while Viagra has definitely helped a lot of individuals and couples, we should also talk about some of the potential downsides, or even just some of the more complex aspects of its impact.
You bring up a really good point. The fact that there was now a so-called quick fix for ED, it raised concerns about unrealistic expectations and pressures around sexual performance.
It's like the focus shifted away from intimacy and connection, and it became more about performance.
That's a very valid concern. We have to remember that sexual satisfaction is complex. It's a combination of physical, emotional, and psychological factors.
So Viagra might help with the physical part, but it's not a magic solution for every relationship problem.
You got it. Open communication, understanding each other, and addressing any underlying emotional or psychological issues. Those are all critical for a fulfilling and healthy sexual relationship.
So it seems like Viagra's impact on relationships is kind of a double-edged sword. It can be a catalyst for positive change, but it can also create new kinds of pressure.
I think that's a great way to put it. It's a powerful tool, but like any tool, it needs to be used responsibly, and we have to be mindful of how it can affect us and our partners.
Now let's shift gears a bit and talk about alternatives to Viagra. We touched on this briefly in part 1, but I'd love to explore those options in more detail.
Of course. So as we discussed, there are other medications that work similarly to Viagra. They're all PDE5 inhibitors. These include tadalafil or Cialis, vardenafil, which is Levitra, and avanafil, also known as Stendra.
Right. They all work by inhibiting that PDE5 enzyme, but they each have different durations of action. and they can have different side effects.
So for instance, tadalafil can last for up to 36 hours. That's why some people call it the weekend pill.
I've heard that. So there's a lot of variety even within the medication category.
There is. And it's also really important to remember that medication isn't the only option.
Right. There are other ways to address ED.
For some men, lifestyle changes can be incredibly effective.
So it's about taking a more holistic approach to health.
Exactly. Things like regular exercise, a healthy diet, stress management techniques, and just getting enough sleep can all have a really positive impact.
And of course, we can't forget about the negative effects of smoking and drinking too much alcohol.
Those habits can be really harmful to your cardiovascular health, and that's directly linked to erectile function.
So even if someone is taking medication, those lifestyle factors still matter a lot.
They do. It's not an either situation. It's about combining healthy habits with any medical interventions.
Now, what about cases where the issue is more psychological than physical? What options are there for those individuals?
Well, in those cases, psychotherapy or counseling can be really helpful. Talking to a therapist can help uncover underlying issues, things like performance anxiety, stress, relationship problems, or even past trauma.
It's about recognizing that connection between the mind and body.
Exactly, and understanding how our emotional well-being can affect our physical health.
And sometimes the best approach might be a combination of different things.
Right, someone might benefit from both medication and therapy.
It's about finding what works best for each individual.
Absolutely. There's no one-size-fits-all solution.
Now, beyond individual choices, it's also important to think about the broader societal implications of Viagra and how it's changed our understanding of men's health.
That's a really crucial point that often gets overlooked. Viagra didn't just start a conversation about ED, it sparked a broader conversation about men's health and sexuality in general.
It challenged societal norms.
It did. It forced us to reevaluate how we approach these topics.
It's like Viagra opened a door that had been closed for far too long.
I like that analogy. And through that open door, we've started to explore new ways of thinking about masculinity, about aging, and about the evolving needs of men throughout their lives.
This also brings up some really interesting questions about medicalization, about the medicalization of sexuality. Is it ethical to use medication to enhance sexual performance? Where do we draw the line between treating a medical condition and just seeking enhancement?
Those are big questions, and there are no easy answers. They force us to examine our values, our understanding of health and well-being, and the role that technology plays in our lives.
So it seems like Viagra's legacy goes way beyond its original purpose. It started these ongoing cultural and ethical conversations.
And that's one of the things that makes this topic so fascinating. We're not just exploring a medication, we're exploring this ever-changing landscape of men's health and how it intersects with societal norms, with technology, and with our own understanding of ourselves.
I think this is a good place to pause and reflect on everything we've discussed.
Great idea. In part 3, we'll dive even deeper into some of these complex issues. We'll be examining the ethical debate surrounding Viagra, and we'll look at its economic implications and how it's impacted gender dynamics and relationships.
So be sure to join us for the final part of our deep dive. We'll wrap things up and leave you with some thought-provoking questions to ponder. And we're back for the final part of our deep dive into the world of Viagra. In parts 1 and 2, we covered a lot of ground, from the science to the personal impacts. And now it's time to tackle some of the bigger picture stuff, the societal and ethical questions that Viagra has raised.
You know, it's fascinating how one medication can spark so many complex discussions.
Right, it's like this little blue pill has become this huge cultural touchstone.
It really has, and it makes sense when you think about it. Our physical, emotional, and social lives are all intertwined. And Viagra addresses an issue that's often seen as sensitive, even stigmatized, so it's forced us to confront some really fundamental questions about health, sexuality, and how technology plays into all of this.
In part 2, we touched on the idea of medicalization of sexuality. Can you talk a bit more about that?
Sure. The fact that Viagra is so readily available has raised concerns. Are we becoming a society where sexual performance is defined by medication?
It's like instead of addressing the root causes, we just reach for a quick fix.
Exactly. And that raises questions about what it means to be healthy. What's considered normal when it comes to sexual function? Are we putting too much pressure on people to conform to certain expectations?
It seems like there's this blurry line between using medication to treat a real medical condition and using it just to enhance things.
Absolutely. Where do we draw that line? That's a question that's still being debated. Some people argue that individuals should be free to make choices about their own bodies and their own sexual experiences, But others worry about potential for coercion, unrealistic expectations, and even the commodification of sex.
It's definitely complicated, no easy answers. And it seems like the ethical considerations go beyond just individuals, right?
Absolutely. Viagra's availability has sparked discussions about healthcare equity and access too.
Meaning not everyone can afford it.
Exactly. The cost can be a barrier for many people, especially those without insurance or those with limited incomes.
So it raises the question, are these medical advancements really benefiting everyone equally?
A very important question to consider. And then there are the economic implications. The pharmaceutical industry has made a lot of money from Viagra.
Yeah, I can imagine.
And that brings up questions about how profit motives influence healthcare decisions and how research priorities are set.
It's a good reminder that money plays a role even in the world of medicine.
Now let's switch gears a little bit and talk about how Viagra has affected gender dynamics and relationships. Some people argue that it's shifted the power balance between partners and that it might be creating new pressures and expectations.
It's an interesting point. A medication that mainly addresses a male issue. How does that impact the dynamics within a relationship?
It really highlights how interconnected our sexual experiences are. A change in one partner's ability or desire can affect the whole relationship.
So it seems like Viagra's impact ripples outward. It touches on ethics, economics, gender roles, the very structure of our society.
It's a perfect example of how something that seems like a simple medical innovation can actually have these huge, far-reaching consequences. And it reminds us that whenever there's a technological advancement, we need to think carefully about the social and ethical implications.
As we wrap up this deep dive, I think it's important to reflect on what we've learned about men's health.
Absolutely. Viagra has definitely played a part in destigmatizing conversations about men's sexual health. It's encouraged men to seek help, and it's put more focus on men's overall well-being.
Like opening a door to conversations that were once off limits.
Exactly. And that's led to more understanding and empathy, which is definitely a good thing. But the conversations we're having about medicalization, ethics, and societal impact, they remind us that there's still work to do. We need to create a culture where men feel comfortable talking about their health, openly and honestly, without feeling judged or ashamed.
So moving beyond just quick fixes, embracing a more holistic view of men's health, that takes into account the physical, emotional, and social factors.
Precisely. And I think one of the most important takeaways from all of this is that any advancement in medical technology needs to be accompanied by thoughtful reflection and open discussion. What are the potential implications for individuals, for society as a whole?
That's a powerful message to end on. Thanks for joining us on this deep dive into the world of Viagra. It's been a fascinating journey, one that's taken us far beyond that little blue pill. We hope this exploration has given you some valuable insights and maybe sparked a curiosity to keep learning about this complex and evolving landscape of men's health.